Today, we're going to talk about Norethin-Eth Estra-Ferrous Fum tablet contraceptives. This medication is used to prevent pregnancy by containing two hormones, norethindrone and ethinyl estradiol. It also includes a small amount of iron in the inactive pills taken during the 4th week. These pills are meant to keep you in the habit of taking one pill each day. In addition to preventing pregnancy, this medication may also make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and treat acne. It's important to note that using this medication does not protect against sexually transmitted diseases. When taking this medication, it's important to follow the daily dosage and take it at the same time each day to ensure its effectiveness. Before you start taking Norethin-Eth Estra-Ferrous Fum tablet contraceptives, make sure to read the patient information leaflet provided by your pharmacist. It contains important details on when to take your pills and what to do if you miss a dose. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. It's best to pick a time of day that is easy for you to remember, and take your pill at the same time each day. If you are taking the chewable pill, chew and swallow one pill every day. Some brands may also be swallowed whole. Some brands should be taken with water while others should be taken without water. Follow the manufacturer's directions for your brand. Consistency is key when taking this medication. Follow the package instructions to find the first pill, start with the first pill in the pack, and take them in the correct order. Do not skip any doses. Taking this medication after your evening meal or at bedtime may help if you have any stomach upset or nausea with the medication. You may choose to take this medication at another time of day that is easier for you to remember. No matter what dosing schedule you use, it is very important that you take this medication at the same time each day, 24 hours apart. If you have vomiting or diarrhea within 4 hours after taking your pill, read the patient information leaflet section titled, "What to do if you miss tablets/capsules." Follow the instructions as if you had missed your dose because vomiting/diarrhea can stop the pill from working. Your pill pack contains 24 pills with active medication. It also contains 4 reminder pills with iron. Take one active pill once daily for 24 days in a row, then take one inactive pill once daily for 4 days in a row after you have taken the last active pill unless otherwise directed by your doctor. If this is the first time you are using this medication and you are not switching from another form of hormonal birth control, take the first pill in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. If your period begins on a Sunday, begin taking this medication on that day. If you have any concerns about switching from other forms of hormonal birth control to this product, consult the patient information leaflet or your doctor or pharmacist. Some common side effects of Norethin-Eth Estra-Ferrous Fum tablet contraceptives may include nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change. You may also experience vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If any of these effects persist or worsen, it's important to contact your doctor or pharmacist. If you miss 2 periods in a row or 1 period if the pill has not been used properly, you should contact your doctor for a pregnancy test. It's essential to remember that this medication has been prescribed because your doctor has judged that the benefits to you outweigh the risk of side effects. However, this medication may raise your blood pressure, so it's important to regularly check your blood pressure and inform your doctor if the results are high. In some cases, serious side effects may occur, such as lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, or yellowing of the eyes/skin. Additionally, this medication may rarely cause serious, sometimes fatal, problems from blood clots. Seek medical help right away if you experience symptoms such as chest/jaw/left arm pain, confusion, sudden dizziness/fainting, pain/swelling/warmth in the groin/calf, trouble speaking, or unusual headaches. While a serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice other effects, it's important to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects. You may also report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects and report side effects to Health Canada at 1-866-234-2345. If you smoke cigarettes or use tobacco and are over 35 years old, it's important to avoid using Norethin-Eth Estra-Ferrous Fum tablet contraceptives. This is because smoking can increase your risk of serious health issues such as stroke, heart attack, blood clots, and high blood pressure when using hormonal birth control. It's important to keep this medication out of reach of children, as accidental overdose of iron-containing products can be harmful, especially for children under 6 years old. If an overdose does occur, it's important to seek medical help immediately or contact a poison control center. Before taking this medication, it's important to talk to your doctor or pharmacist about any allergies you may have to ethinyl estradiol, norethindrone, or ferrous fumarate, as well as any other estrogens, progestins, or iron products. It's also important to discuss your medical history, including any history of blood clots, high blood pressure, cancer, diabetes, heart problems, liver or kidney disease, and thyroid problems. If you have diabetes, it's important to monitor your blood sugar regularly and notify your doctor of any changes. You should also inform your doctor if you will be having surgery or if you will be confined to a bed or chair for a long time, as these conditions may increase your risk of blood clots. This medication may also cause skin discoloration, so it's important to limit your time in the sun and avoid tanning booths and sun lamps. If you wear contact lenses, you may experience vision problems, so it's important to contact your eye doctor if you have any issues. It's important to note that it may take longer to become pregnant after stopping this medication, so it's important to consult your doctor if you are planning to conceive. Additionally, this medication should not be used during pregnancy, and if you become pregnant while taking it, you should notify your doctor immediately. Finally, this medication may decrease breast milk production, so it's important to consult your doctor before breastfeeding while taking this medication. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Norethin-Eth Estra-Ferrous Fum tablet contraceptives include aromatase inhibitors, fezolinetant, aspemophene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. Certain drugs may also cause hormonal birth control to be less effective, leading to a higher risk of pregnancy. These drugs include griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, and HIV drugs, among others. Always inform your doctor when starting any new drug and discuss whether you should use additional reliable birth control. It's also important to tell your doctor if you experience any new spotting or breakthrough bleeding, as these could be signs that your birth control is not working effectively. Additionally, this medication may interfere with certain lab tests, so make sure your lab personnel and doctors are aware that you are taking Norethin-Eth Estra-Ferrous Fum tablet contraceptives. If you or someone you know has taken too much of Norethin-Eth Estra-Ferrous Fum tablet contraceptives and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It's crucial to get help right away in case of an overdose. It's important not to share Norethin-Eth Estra-Ferrous Fum tablet contraceptives with others. Make sure to have regular complete physical exams, including lab or medical tests like blood pressure, breast exam, pelvic exam, and pap smear, while taking this medication. Follow your doctor's instructions for examining your breasts, and report any lumps right away. Don't forget to keep all medical and lab appointments. If you need more details, consult your doctor. If you miss a dose, refer to the product package for instructions. To prevent pregnancy, you may need to use additional birth control methods like condoms or spermicide. If you have trouble remembering to take your pills, talk to your doctor about other birth control options. It's important to store norethindrone, ethinyl estradiol, and ferrous fumarate tablets at room temperature, away from light and moisture. Be sure to keep them out of reach of children and pets, and do not store them in the bathroom. When you no longer need the medication or it reaches its expiration date, it's crucial to properly dispose of it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. And remember, never flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.